Agimfor, a guide to safe and effective use. Agimfor is a medication used to treat type 2 diabetes. It helps control blood sugar levels by enhancing the action of insulin, enabling the body to utilize glucose more effectively. 1. Precautions when using Agimfor. Note: patients need close monitoring by a physician throughout the duration of Agimfor use. Absolutely do not use Agimfor without a doctor's prescription. 1. Precautions when using Agimfor. Always inform your doctor about any medications you are taking, including over-the-counter drugs, herbal remedies, vitamins, and dietary supplements. Closely monitor any unusual signs in your body while using Agimfor and inform your doctor immediately. Here are some cases that require special attention when using Agimfor. Congestive heart failure. Agimfor can increase the risk of cardiovascular disease. Therefore, patients with congestive heart failure need to be closely monitored by a doctor. Here are some cases that require special attention when using Agimfor. Acute myocardial infarction. Agimfor can increase the risk of cardiovascular disease. Therefore, patients with acute myocardial infarction need to be closely monitored by a doctor. Here are some cases that require special attention when using Agimfor. Cardiovascular collapse. Agimfor can lower blood pressure. Therefore, patients with cardiovascular collapse need to be closely monitored by a doctor. Patients with chronic hypoxic lung disease. Agimfor can worsen the oxygen deficiency in patients with chronic lung disease. Here are some cases that require special attention when using Agimfor. Severe infection, sepsis. Agimfor can increase the risk of infection. Therefore, patients with severe infections need to be closely monitored by a doctor. Here are some cases that require special attention when using Agimfor. Acute metabolic decompensation, pregnancy. Agimfor can affect fetal development. Therefore, pregnant women need to be thoroughly consulted by a doctor before using Agimfor. Here are some cases that require special attention when using Agimfor. Discontinuation of metformin in individuals undergoing X-ray imaging requiring iodine-containing contrast agents. Metformin can cause lactic acidosis when injected with iodine-containing contrast agents. Therefore, it is necessary to discontinue the use of Agimfor during this period. Here are some cases that require special attention when using Agimfor. Necrosis, malnutrition, alcoholism. These conditions can increase the risk of side effects from Agimfor. 2.1 How to use Agimfor is taken orally. Take Agimfor with breakfast and dinner to minimize unwanted effects on the stomach and intestines. Swallow Agimfor tablets whole with plain water. Do not crush, chew, or mix with any other substances. Adhere strictly to your doctor's treatment instructions. 2.2 Dosage. Start with a dose of 500 mg DAY, taken once with breakfast. If repeat blood sugar tests do not achieve control, the dose can be gradually increased every week. Maximum dose is 5 tablets of 500 mg or 3 tablets of 850 mg per day, divided into 23 doses. 2.2 Dosage. The maintenance dose after achieving blood sugar control will be adjusted by your doctor. 3 Side effects of Agimfor. The most common side effects of Agimfor are nausea, diarrhea, abdominal pain, loss of appetite, fatigue, dizziness, and headache. More serious side effects can occur, including hypoglycemia, kidney failure, anemia, heart failure, hepatitis, liver dysfunction, and abnormal heart rhythm. 3 Side effects of Agimfor. If you experience any side effects, notify your doctor immediately. 4 Storing Agimfor. Store Agimfor at room temperature, in a dry place, away from direct sunlight, and out of reach of children. Do not use Agimfor after the expiry date printed on the packaging. Note: information on Agimfor provided in this article is for reference only, not a substitute for medical advice. For storing Agimfor, always consult your doctor before using Agimfor or any other medication. Your doctor is a medical professional who understands your health condition, so always trust and follow your doctor's instructions.